Now we'll move to Italy. We have Duilio Maria from RAI Italian Public TV. Duilio, are you there? Duilio, yes. Can you hear us? Oh, you are there. Please go.
Yes. I'm here. All right.
That's bad feedback. Duilio, try and say your question again. If not, I'll read it out because I do have some text on your question. It sounds like we can't hear. I'll read out your question, Duilio. Duilio wanted to know what WHO thinks about testing and active surveillance in Italy at this stage. What should Italy be doing in terms of testing and active surveillance?
I think our Italian colleagues, and we actually spoke with our Italian colleagues today, and we have a very senior member of our staff currently embedded in Italy and providing high-level inputs and advice. And our regional director, Hans Kluge, is also in constant contact with the Ministry of Health. Italy is breaking down its problem. It's looked at each and every single one of its provinces and trying to look at those provinces in terms of where they are. I think many of you will have seen Tony Fauci and others speak about this in the US. We need to start looking at the data. We need to start breaking the problem down. You can't look at a whole country as one entity. You break the problem down, you look at your local geographies, you see what the situation is in each and every administrative level, and then you decide what the best tactics are. There are some parts of Italy where transmission is very intense, and it's very difficult to get a handle on testing all cases, on doing contact tracing. There's a real attempt to save life at this point, and the lockdown measures are there in order to try and suppress infection. But there are parts of Italy in which transmission is not that intense, and where there's a real possibility of avoiding the worst that has happened in many of the parts of northern Italy. So I believe that our Italian colleagues are trying to scale up, as the Director General has just said, train the workforce, train public health workers, get out and do community detection, to detect suspect cases, to isolate suspect cases, to trace contacts. But we fully understand that in certain areas, right in the centre, epicentres, it is difficult to do that when you're dealing with the heavy wave and dealing with the health system under huge pressure. So we really do admire our colleagues in Italy. They're heroes. They're putting up a courageous fight against this virus on behalf of their own people, on behalf of the world. And we like and support the way they're breaking the problem down. They're working their way through the problem, and we will do everything in our power and the World Health Organization to support them in their efforts.
Thanks. If I could just supplement what Mike has said. Beyond Italy, I think there are many countries that are looking at the situation that they're in, the transmission situation that they're in, and the situation seems completely overwhelming. And that testing, with us saying test and how important that is as part of this comprehensive package is a fundamental aspect that needs to be enhanced. And we hear you. We are on the phone with our colleagues every day who say to us, this seems impossible. This is not something that we can do. What should we do? We've been very clear that it's critical that you test to find where this virus is so you know where you're fighting it, to find all of your suspect cases, test those suspect cases, find those contacts, test those contacts who develop symptoms. And by doing so, you are able to actually break down those chains of transmission. But when the situation is such that you have community-wide transmission and there are some areas of very large outbreaks, there's ways in which you may need to prioritize some of those actions so that you could break down the problem, like Mike has just said. Find those boundaries of where that big outbreak is so that you could bring it more under control. And in taking those making those tough decisions temporarily will help you, bring you back to being able to actually find all those suspect cases. As the Director General has said, these so-called lockdown measures that many countries have implemented, and more we're hearing about countries implementing these so-called lockdown measures. This is buying you a little bit of time, and that time needs to be used appropriately. And that time must be used to build up again your workforces to be able to find those cases, to be able to break down a much larger problem into something that becomes more manageable. We have guidance that we have on our website, which works through with all countries, which transmission scenario you may be in, outlines some of the considerations that you may need to take if you're in clusters, large clusters of cases, or if you're in community transmission, with the overall aim of bringing you back from community level transmission to clusterings of cases down to individual chains of transmission so that that transmission can be suppressed and you can bring those outbreaks under control. We hear you. We understand that this is overwhelming in many cases, but there are things that you can do to suppress and slow transmission and save lives.
Just 2 lines. You know, the commitment of the Italian government is really, really incredible. And we can see on the ground how it's moving now. And not only that, the cooperation from the citizens of the country, from Italy, is also amazing. And I think this will bring result, and that's what WHO believes. And as Mike said, we will do everything to support. And there are some good signals now. We had a discussion with some of the senior experts from Italy today, and we hope this positive signal and progress will continue. But I am really happy to see that Italy is doing all it can.